Welcome to another Counselor Soapbox video. Today's video, Drug Counseling Part 2, covers the domain of engagement. The domain of engagement includes three separate skills that counselors need to know about and develop. One is screening, another intake, and lastly, orientation. Screening may mean two very different things. One is evaluating the client to see if they have a need for treatment. There are formal instruments that can be used, written ones. A simple method is called the cage, and we'll talk about that briefly. Screening may happen out in the community where you identify people who have a problem with alcohol or drugs. The other thing you're screening for is, does this client belong in your program? If you work in a drunk driving program, you would not admit someone with a methamphetamine issue. The other thing you want to look for is, can you accommodate their needs? Under the Americans with Disability Act, we need to be careful to make sure that we accommodate people regardless of their disability. But one program might have materials for people who need their information in Braille, while another program might put in elevators or ramps to accommodate people in wheelchairs. So you have to look at the resources your program has to meet this particular client's needs. There are several definitions of screening. The IC and RCs define screening as the process by which a client is determined appropriate and eligible for admission to a particular program, and they include this under the general domain of engagement. TAP 21 includes screening under the heading clinical evaluation and defines it as the systematic approach to screening and assessment of individuals thought to have a substance use disorder being considered for admission to addiction-related services or presenting in a crisis situation. Both of these definitions can be helpful. What are the key differences between the IC and RC, or the TAP 21? And we'll try to cover both of these systems of understanding the job duties of a counselor in this video. The IC and RC is an international group that accredits counselor programs. It's emphasized by NADAC or KDAC, and people who go through these kinds of trainings in California will probably register with CCAPP, one of the registering and certifying bodies. TAP 21 was developed by SAMHSA. It's the core curriculum of KD's accredited schools, and the program I teach in at Fresno City College is KD accredited. The screening function involves determining if the client is appropriate for your program. Do they have the particular problem that you are treating? First of all, do they have a substance use disorder? And also, do they have other problems that are more immediate and require attention before they enter your treatment program? For example, do they have a medical issue? Also, do they need services that you do not offer? Not every program has the ability to do detox. Sometimes that's referred to a hospital or medical facility. Some people are required to do a DUI program. Your program may be designed more for drug use. Some patients, clients, may need to be on methadone maintenance, and many drug programs do not have a doctor that can prescribe that methadone. There are a number of other reasons why they might need particular services. If it's court-ordered, for example, domestic violence counseling, that may not be a service that your program is approved to provide. You also need to look at, are they acceptable? We have to look at the Americans with Disability Act and say, can you accommodate their disabilities? And if not, can you refer them to a program who can accommodate those disabilities? There also may be reasons why your program would not be willing to accept someone. For example, if you have a residential program which includes women and children, you would not be able to admit registered sex offenders in that program. There might be other reasons why certain people with certain criminal records would not be acceptable in your particular program. That doesn't mean they can't be treated, but it means they need to be referred to a treatment that a program that is able to accept them. There are a number of reasons why a client might not be appropriate for your program. Age is one of those. If you have a program designed to treat adults, you would not want to admit a child or a minor under the age of 18. You might have a program that is aimed primarily at elderly or senior citizens and provides some additional assistance for them. You might not be able to accept someone who has serious medical issues. All of these are factors. Gender might be an issue. Some programs are gender specific for women only or women with children or men's only programs. Also, residents, are they a resident of your particular county if your program is funded through the county? Funding source, do you take their insurance? Their legal status. If people are referred by parole, probation, court ordered, you need to know whether you are able to provide the services the court is requiring under that court order. Veteran status. Many veterans receive their treatment through VA. And referral source. Various referral sources, CPS, for example, might have contracts with certain programs. They will pay if the client enters those. Other programs are not contracted and would not be able to bill for that service. Also, you need to look at, does this client need another level of care? If you do an outpatient program, maybe this client needs residential or vice versa. All of these are factors in determining if the client is appropriate for your program. Here's some reasons I've seen clients not be accepted by particular programs. Someone who is a registered sex offender would not be put in a program that also has children. They would be referred to a program that specializes in treating registered sex offenders. Arsonists may not be acceptable, depending on their criminal history, in a residential program where people's lives could be at danger. If they're not a part of your target population, if you treat women and this is a man, that might be a reason to not accept the client. And if your program is the wrong modality, it's not appropriate to put somebody into residential treatment who could just as easily be treated in outpatient, or to put somebody into outpatient whose problems are so severe that they need residential treatment. When should the counselor begin to screen the potential client? Well, when the first contact is made, and often that's over the phone, or if you receive a paper referral, when you receive that referral, you would begin to screen. If the referral doesn't seem to be the kind of treatment you provide, it wouldn't be appropriate to bring that person into your treatment facility. Often, however, you don't have enough information when you receive the referral or on the phone. And so when you see the client in person at the beginning of the very first appointment, right after you've covered some of the legal confidentiality issues or informed consent issues, then you would screen to make sure that this is someone you want to bring into your program and someone who would benefit from being there. How do you go about screening? Well, first, the counselor needs to use good counseling skills. A big part of that is needing to listen and needing to engage the client. Screening could be done by office staff, but a certified counselor should know how to do this screening. The first contact between the program and the client is very important. Regardless of who does the screening, this first contact sets the tone for the entire treatment episode. If someone is treated rudely or becomes frightened in the initial contact, they may never reach the counselor to discuss their issues. Clients often may be nervous, embarrassed, or uncertain about what's going to happen in this treatment episode. What does the counselor need to know to be competent at screening? The screening global criteria includes how to evaluate for substance use disorder, the ability to determine the client's eligibility for admission or referral, and determining the client's appropriateness for admission. The two basic parts you'll think about are they eligible to be admitted, and are they appropriate for your program? Are there any problems that would be barriers to treatment? Physical issues, mental issues, or medical issues? All of those might need to be attended to first, or the client might need to be referred to a program who can accommodate those issues. Also, you need to be looking for any legal, ethical, regulatory, or program policies that would be a problem. Confidentiality requirements are an important consideration. These should be explained to the client early in the very first session. The two things the counselor is thinking about are HIPAA, Health Insurance Portability and Accountability Act, which provides for protection of health records. Also, the counselor in drug and alcohol programs is thinking about 42 CFR, Code of Federal Regulations, Part 2. That provides an even higher level of protection for the records of someone in a drug and alcohol program. The idea here is that treatment in a drug and alcohol program should be so confidential that it encourages people to go for help rather than worry about someone else finding out they have had this issue. Under that provision, a counselor can't confirm or deny that someone is in drug treatment. If someone calls up and said, "I dropped so-and-so off at your program earlier today, are they out of group?" You cannot confirm or deny that they're even your client without a written release of information from the client to talk to that person. There's been recent efforts to align HIPAA and 42 CFR Part 2 to make them closer together. That's a regulatory issue, and we'll have to see how that progresses in the future. When we talk about drug treatment, we usually describe it in terms of its modality. Modality is kind of a fluid concept. Different programs arrange their modality in different ways. The basic components that may be assembled to create your program's modality could include detox. Do you do detox there, or do you have people detox somewhere else before they enter your program? Is the program inpatient, medical facility, or residential, maybe social model? It could be arranged to be part of a day. We sometimes call that drug rehabilitative. Or it could be organized as outpatient. Some programs may include multiple elements. The client goes through detox, spends a period of time in residential inpatient drug treatment, then progresses to an outpatient. Outpatient treatment could be as little as an hour or hour and a half, or a 2-hour treatment once a day, or even one time a week. Also, programs can change the intensity over time. Some programs begin with an hour and a half to 2 hours a day, 5 days a week. After a period of time, this is reduced to one time a week, and maybe after that, a monthly follow-up meeting. A modality could also include such things as methadone maintenance, harm reduction, for example, teaching people to drink or smoke less. It could include having a family group that's available not only to your client, but to their family or support system. Some programs include childcare, some on the premises, some temporary. Some programs include sober living so that after the person leaves residential, they have a place to stay, or while in outpatient, they might have a sober living home. Some programs include other services such as job training or mental health treatment. The next part of the engagement process involves intake. Intake is an administrative function and includes various paperwork that needs to be completed. This may be done by a designated intake person, or it could be the counselor who's available. Some programs arrange for the counselor who will be working with this client on a long-term basis to do their own intake. The core function of documentation also needs to be used during this intake procedure. Here are a couple of definitions of intake to help you understand the function better. The ICNRC defines it as administrative and assessment procedures for admission to the program. TAP 21 includes this under documentation, which has 5 different components. Documentation is the recording of the screening and intake process, assessment, treatment plan, clinical reports, clinical progress notes, discharge summary, and other client-related data. You can see how, as long as the paperwork gets done, a program might organize when and where these various functions occur. There are a great many possible intake forms, and some of these, the content may overlap. These forms could be called an admission agreement, an intake agreement, consent for treatment. There may be a form for HIPAA, a receipt of notice of privacy practices. The client may be required to fill out certain insurance or billing forms, and there may be a need for releases of information, or more technically, consent to release information, so that the treatment program can communicate with the referring source or other people who will need to know about the progress in treatment. There are other possible intake forms. The more of these the beginning counselor knows about, the more easily they'll make the transition to working at a particular program. Of course, they're likely to be retrained at that program in the specific forms that are used there. The counselor may need to fill out a form or do the process called informed consent. They also need to explain to the client exceptions to confidentiality. There will probably be a fee agreement. There may be consents to contact, sometimes called releases of information. There could be consent to follow up, so that even after you discharge a client, you would have permission to contact them and see how they're doing. This is important in programs which receive grant funding and need to do ongoing research to demonstrate the effectiveness of their program. You would gather client demographics, and you probably would have forms describing both the rights and responsibilities of the individual client. It's important to think about intake from the client's point of view. Intake is likely to be very anxiety-provoking. The client doesn't know your procedure, doesn't know what to expect. They may have been forced into treatment by some referral source, and here they are forced to tell a total stranger a great deal of intimate details about their own personal business. The process of intake is extremely important. It sets the stage for what happens throughout the rest of the treatment. This is the time to help develop a relationship with the client. Clients may decide to enter or leave treatment solely based on their experience during the intake interview. It's possible that the intake function will be combined with other functions. Intake is basically the legal paperwork stuff, but it could also include things like screening, orientation, assessment, treatment planning, case management, and of course involves records and record keeping. We'll look at these separate functions in later sections of this series. One important task that the counselor needs to undertake very early in the process is orientation. Sometimes this is part of the intake process, and sometimes it happens directly after the intake. The definition of orientation includes describing the general nature of the program, describing the goals of the program, both from the program standpoint and from the client's, including rules of conduct, information about infractions of the rules and how they would be punished, what discipline might be used, reasons why someone might be discharged from your program. The client also needs to know the hours of the program, the costs, their rights, and how to contact the program outside of normal office hours. What is orientation in a substance abuse program? It's letting the client know what is expected. That may include what we call socializing them to your treatment modality. What activities will be used to help them achieve sobriety? They need to know what is going to be expected of them, what will happen during the treatment. Most of the orientation is administrative. You may tell them the names of their counselors or what rooms they go to or where the bathrooms are located. Part of orienting the client is orienting them to the rules of your program. What are the rules for the program? Might include things such as smoking. Are there certain smoking areas? Can they come and go? Or are they required to stay on campus and would be terminated if they left? When is group in session? What happens if they're late to a group? You also need to tell them about any rules about food and drink. Can they bring it? When can they eat? Where can they have it? Clothing can be an important rule to describe. Most programs prohibit things that might be gang related, certain colors, certain sports teams, jerseys, etc. Will they be required to perform any duties? Some programs include job functions, cleaning outside areas, and so on as part of their program. They need to know where the rooms are located. If they have a room where they are going to be sleeping, they need to know which is their bed. If groups are held in multiple rooms, what is their group schedule and when are they where? And some programs have multiple buildings or parts of buildings, and they need to know where these various rooms are located in the program. Also, they need to know who are the staff. Good orientation fosters the therapeutic relationship between all of the staff members and the new client. There are a number of different ways in which a counselor might orient a client to their program. A counselor might include multiple ways of providing orientation. They can do some of it or all of it orally. There may be written material, such as a map of the facility or a list of rules. The counselor might give the new client a tour of the facility and introduce them to other staff. However it's done, you need to document in your notes how you oriented the client. This reduces the possibility of lawsuits, malpractice claims, and even just complaints that the client didn't know what the rules were or what they were supposed to be doing. Some underlying principles of orientation it's important to be aware of. Orientation is about the program's goals and objectives. Make sure that the client wants what you are offering, and client goals come later during treatment planning. Orientation helps the client understand the program's goals. Orientation involves an understanding of how this program works. What are the days and hours of treatment? What happens if there's a holiday? Can they have visitors? And what do the visitors need to do to be allowed to come? Are there classes available, and does the client have a choice of classes, or will they be assigned a particular set of groups to do? Are there any outside meeting requirements? Some programs require their clients to attend 1 or 3 or some number of outside self-help groups each week. Will there be homework? If there's homework, will it be written, or is it something they need to tell the group about? If people have learning disabilities, it may be necessary to help someone who has difficulty with reading and writing if there's going to be written homework. You also need to provide the client with phone numbers and how they might reach someone if they need to. And you might provide them both a daily and a weekly schedule if things change from time to time. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the CounselorSoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.